Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a general practitioner talking to a patient named Mr. Edwin. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Edwin. I understand you've been experiencing some concerns related to your recent diabetes diagnosis. Before we dive in, how are you feeling about everything?
It's all a bit overwhelming, to be honest. I didn't expect this diagnosis, and now I'm just trying to understand what it really means for me, day to day.
That's completely understandable. Diabetes, especially type 2, often requires a shift in lifestyle and daily habits. But with the right approach, it's very manageable. Let's go over any specific symptoms or difficulties you've been experiencing. Can you tell me more about your current routine?
Sure. I work long hours at a desk job, so I don't get much physical activity. My diet probably hasn't helped much either. Quick meals, snacks, lots of coffee. I've also been feeling more tired than usual and noticed I get pretty thirsty at random times.
That tiredness and increased thirst are quite common with diabetes. When blood sugar levels stay high, it often leads to increased urination, which can dehydrate you and make you feel more fatigued. Do you check your blood sugar regularly?
Not yet. I haven't started monitoring it on my own. I guess I'm not really sure how, and honestly, the whole thing feels a bit daunting.
Understandable. Learning to manage diabetes can feel like a big change, but we'll take it one step at a time. I'll walk you through using a blood glucose meter, which will help you keep track of your levels. Knowing your numbers is a valuable tool for managing the condition.
I see. I'm also worried about long-term complications. I've read that diabetes can lead to serious health issues.
Yes, untreated or poorly managed diabetes can lead to complications such as nerve damage, cardiovascular disease, and vision problems. However, with good blood sugar control, you can significantly reduce your risk. Let's discuss how lifestyle changes can help with that. First, tell me a bit more about your physical activity.
Honestly, I'm not very active. I used to walk regularly, but that hasn't happened much in the past year or so.
Exercise is a great way to help manage diabetes because it helps your body use insulin more effectively, which can lower blood sugar levels. Starting with something simple, like a daily 20 to 30-minute walk, can make a big difference. Do you think that's something you could work into your routine?
I think so. I can probably start with short walks after work or during my lunch break.
That sounds like a great start. As you feel more comfortable, you can gradually increase your activity. Small, consistent changes can lead to big improvements over time. Now, regarding your diet, are there any areas you're especially concerned about?
I know I eat too much processed food, quick meals and snacks, like I said. I don't really plan meals, which probably isn't the best approach.
Meal planning can help you make better choices, especially with diabetes. Try aiming for balanced meals with whole grains, lean proteins, healthy fats, and plenty of vegetables. Reducing sugary foods and refined carbs will also help stabilize your blood sugar. I can provide some resources to help with meal planning if that would be useful.
That would be great. I think part of it is just needing to know where to start.
Absolutely. Starting can be the hardest part, but with a few adjustments, you'll find a routine that works for you. Now, do you have any questions about medication? I noticed you're not on any medication yet, is that correct?
Yes, I haven't started any. Is medication necessary, or can I manage this through lifestyle changes?
In some cases, type 2 diabetes can be managed through lifestyle alone, especially if you catch it early. However, if blood sugar levels are high, medication can be very helpful in controlling them. We'll monitor your progress, and if lifestyle changes alone aren't enough, we can discuss options like metformin, which helps lower blood sugar levels.
I see. That makes sense. So, I'd have regular checkups to track how things are going?
Yes, exactly. Regular checkups allow us to see how well your lifestyle changes are working and make adjustments as needed. I recommend coming in every 3 months for now to review your blood sugar levels and overall health.
That sounds good to me. I just want to make sure I'm doing everything I can.
I can see that, and it's great to see you taking such an active role. In addition to exercise and dietary changes, prioritizing sleep and managing stress can also help you control blood sugar. High stress levels can increase blood sugar, so finding ways to relax, whether through hobbies or mindfulness exercises, is important.
I hadn't thought about stress affecting my blood sugar, but that makes sense. I'll try to work on that too.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Mrs. Frank. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Frank. My name is Dr. Norman. How are you doing today?
Well, I wouldn't say I'm doing fine. My skin has been driving me crazy lately.
I understand. Skin issues can be very frustrating. I see from your records that you've been experiencing dryness. Could you tell me a bit more about what's going on?
Yes, it's been terribly dry, especially on my legs and arms. No matter how much moisturizer I put on, my skin just feels rough and even scaly. It's almost like sandpaper.
That sounds uncomfortable. How long have you been dealing with this dryness?
It's been about 3 months now. It used to be just a little itchy, but it's gradually gotten worse. And now it even hurts sometimes.
Has anything changed in your routine or environment over the past few months, like new skincare products, laundry detergent, or even moving to a different climate?
Not really. I've been using the same lotion and I haven't moved or anything like that. But I did notice it got worse during the winter.
Yes, cold weather and low humidity can certainly worsen dryness, a condition we call xerosis. It's especially common in the winter months. Have you noticed any cracking or bleeding in the dry areas?
Yes, unfortunately. My heels and elbows even started to crack, and it stings whenever I try to put lotion on them.
I see. Xerosis, or dry skin, happens when your skin loses its natural oils, which protect and maintain moisture. When the outer layer becomes too dry, it can cause the cracking and scaling you're experiencing. Let's also talk about a few factors that may be contributing, such as age, hydration, and the types of soap or body wash you're using.
Oh, I didn't realize age had anything to do with it.
Yes, skin tends to become drier with age, as it produces fewer natural oils. Hydration is another factor. When we're dehydrated, it affects skin moisture levels as well. Do you know if you're drinking enough water each day?
To be honest, probably not as much as I should.
It's a common issue, but keeping hydrated is important. Also, certain soaps, especially those with strong fragrances or harsh ingredients, can strip the skin of its natural oils. Are you using any scented or antibacterial soaps?
I do like to use some scented body washes, but I never thought it could be making things worse.
Yes, fragranced and antibacterial soaps can indeed worsen dryness. Switching to a gentle, fragrance-free cleanser can help maintain moisture. Additionally, while moisturizing is key, There's a certain technique that can help it work better. Are you applying it right after bathing, while your skin is still damp?
No, I usually dry off completely and then put it on.
Applying moisturizer right after patting your skin dry can help lock in moisture much more effectively. I'd recommend a thick, fragrance-free cream rather than lotion, as creams tend to be richer and more hydrating. I can suggest a few options that might work well for you.
That would be great. So, are there any treatments beyond just using creams?
Yes, for cases where xerosis is severe, we can consider other options. If your skin doesn't improve with moisturizers, I might prescribe a topical ointment that includes urea or lactic acid, which can help by attracting moisture to the skin.
So is xerosis something I'll have to manage long term?
It's possible. For many people, dry skin is a recurring issue, especially during colder months. However, with the right skincare routine and a few lifestyle changes, you should be able to control it quite well. In addition to moisturizing, keeping your showers short and warm, rather than hot, can prevent skin from drying out further. Using a humidifier at home can also help if the air is particularly dry.
I hadn't thought about using a humidifier, but that makes sense. And I guess I'll have to cut down on the hot showers.
It can be a challenge, especially in the winter, but it's worth it to prevent dryness. Let's start with these adjustments, and if the xerosis persists or worsens, we can look into more intensive treatments. We'll also monitor for any cracks or signs of infection, as those can sometimes develop if dryness is severe.
Thank you, Doctor. This all makes sense, and I feel better knowing there's a plan.
You're very welcome. Dry skin can be tough to deal with, but with these changes, you should see improvement soon. If anything unusual comes up, or if you have concerns, don't hesitate to come back.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor talking to a colleague. Now read the question.
Hello, Dr. Smith. Do you have a moment? I'd like your advice on a patient of mine.
Sure, go ahead. Tell me about your patient.
I have a 50-year-old man with slightly elevated cholesterol. He has no history of cardiovascular events, but he does have a family history of heart disease and a few risk factors, like mild hypertension. He's asking if he should start statins, and I'm considering it, but I'm not sure if it's warranted yet.
Current guidelines suggest that statin therapy can be beneficial for patients with elevated cholesterol and additional risk factors, especially when there's a family history of heart disease. So if your patient is open to it, initiating statins may indeed help reduce his risk.
Now look at question 26. You hear a member talking about an agenda. Now read the question.
Us more about this issue.
Yes, certainly. As we've all been noticing, the surgery department is experiencing frequent delays and cancellations of procedures. This is mainly due to an overbooked schedule, as we're trying to accommodate a large volume of surgeries without enough time or resources. For example, the operating rooms are often fully booked, and there's limited availability of surgical teams. As a result, patients who are scheduled for surgery often face cancellations or delays, leading to dissatisfaction and repeated rescheduling. This not only affects the patient's health but also strains our resources further when they have to be rescheduled, creating a cycle of continuous backlog.
Now look at question 27. You hear a medical professional explaining or talking about a patient. Now read the question.
We have Ms. Julia Roberts, a 35-year-old woman who underwent surgery for a fractured femur yesterday afternoon. The operation went smoothly, and she's now in a full leg cast. Her post-op observations are stable, her temperature is 36.8 degrees Celsius, and her blood pressure is 128/76. She's been managing her pain well with minimal analgesia, only requiring a mild dose overnight. She's able to wiggle her toes, and capillary refill time is normal. I've already scheduled her follow-up X-ray in 3 days. She's being educated on cast care and the importance of keeping it dry. Before discharge tomorrow, she'll need a printed follow-up plan. Could you make sure she gets that, please? I've also left notes for the physiotherapy team to check in with her later.
Now look at question 28. You hear an anaesthetist discussing potential risks with a patient before her upcoming surgery. Now read the question.
So, Mrs. Thompson, before we proceed to the theatre, do you have any questions or concerns about the procedure?
Yes, actually, I do. I've been thinking about what you mentioned earlier, and it's making me anxious. I know you said the chances are minimal, but what about reactions to the anesthesia? I've heard about rare cases where people have complications, like nerve damage or severe allergic reactions. How do you manage such situations? It's a bit frightening to consider, even though I trust the team here.
It's completely natural to feel this way before surgery. We take every precaution and have comprehensive monitoring to quickly respond to any issues. Safety is our top priority, and we'll be with you every step of the way to ensure everything goes smoothly.
Thank you for explaining that. It's reassuring to know that measures are in place, even though I'm still a bit worried about the unexpected.
Now look at question 29. You hear are two colleagues taking to each other. Now read the question.
Did you see the recent article about patient-reported outcome measures for visual impairments after a stroke?
Yes, I found it interesting that there's such a variety of PROMs used to assess visual function and quality of life in stroke patients.
Honestly, I feel like we could have identified the gaps in PROMs for post-stroke vision issues without a whole systematic review.
Well, you need comprehensive evidence to enhance treatment approaches. This review provides a solid foundation to push for better PROMs specific to vision impairment post-stroke.
It certainly makes a strong case for developing more targeted PROMs. If they were more reliable, it would improve assessments and interventions for these patients.
Absolutely.
I only wish the article went into more detail on which PROMs are currently the most effective.
There's a reference to the full study in the journal, so you could always look it up for more specifics.
Now look at question 30. You hear an intern asking a senior doctor a question after a training session. Now read the question.
About the treatment protocol you discussed in today's training session. Do you have a minute?
Of course. Was there anything unclear about the recommendations for managing seasonal allergies?
Not exactly the recommendations themselves. I understand that you suggested antihistamines as the first-line treatment over corticosteroid nasal sprays. But I was wondering, why is that? Isn't it true that nasal sprays can provide more direct symptom relief?
That's a good question. The reason we start with antihistamines is that they target histamine release, which is a primary cause of the symptoms in seasonal allergies. Antihistamines often act faster, with fewer side effects when used regularly at the start of allergy season, which is why they're typically recommended first.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear Dr. Michelle Carter discussing about physician-assisted dying. You now have 90 seconds to read questions.
My name's Dr. Michelle Carter, and I'm here today to discuss a deeply divisive yet critical topic in modern healthcare: physician-assisted dying, often referred to as PAD. It's an issue that challenges ethical principles, individual autonomy, and the core of compassionate care. While some argue PAD empowers terminally ill patients to make autonomous decisions about their end-of-life care, others worry it opens a Pandora's box of moral, legal, and societal concerns. The debate over PAD isn't new, but it has gained momentum as legislation permitting the practice becomes increasingly common in parts of the world. Countries like the Netherlands, Canada, and Belgium, as well as several U.S. states, have legalized PAD under strict conditions. Proponents view PAD as a means to alleviate unbearable suffering, respecting a patient's wish to die with dignity. They emphasize that this practice is not about abandoning patients, but about giving them a choice when all other avenues of relief have been exhausted. However, opponents of PAD argue it goes against the fundamental role of physicians as healers. They raise concerns about a potential slippery slope where the practice could expand beyond terminally ill patients to those with less severe conditions, such as mental health issues or disabilities. There's also the fear that vulnerable populations, including the elderly or economically disadvantaged, could feel pressured to choose PAD due to societal or financial burdens. One of the most pressing ethical dilemmas in PAD revolves around the Hippocratic Oath, which states, "First, do no harm." Advocates argue that prolonging a life of unbearable pain can itself constitute harm, while opponents contend that any action to intentionally end a life violates this core tenet of medicine. The question remains, can alleviating suffering justify a practice that fundamentally opposes the traditional role of a physician? Recent studies shed light on how PAD is perceived among healthcare providers. A 2022 study conducted in Canada surveyed physicians practicing in jurisdictions where PAD is legal. The results revealed a division in opinion. 60% of respondents supported PAD in principle, but expressed discomfort with participating directly. Among those who opposed it, many cited religious or personal values as key factors influencing their stance. Yet despite the ethical controversy, the majority of participants acknowledge that PAD, when carefully regulated, can bring immense relief to patients experiencing prolonged suffering. Another critical aspect of the debate is the role of palliative care. Opponents of PAD argue that advancements in palliative medicine make it possible to manage pain effectively, eliminating the need for assisted dying. Yet, proponents counter that even the best palliative care cannot address all forms of suffering, such as psychological distress, loss of autonomy, or existential despair. For some patients, PAD represents the ultimate form of control in a situation where they feel they have none. The emotional toll on physicians who participate in PAD cannot be overlooked. Studies show that many experience significant moral distress, even when they believe they are acting in the patient's best interest. This highlights the need for clear protocols and support systems to guide healthcare providers through such challenging situations. As healthcare professionals, our primary obligation is to the patient. For some, this means ensuring the opportunity to live as long as possible, regardless of the suffering involved. For others, it means respecting the right to die with dignity. Striking a balance between these perspectives requires not only robust legislation but also open, empathetic dialogue between patients, families, and caregivers. In conclusion, the debate on physician-assisted dying is unlikely to be resolved anytime soon. It challenges our understanding of ethics, compassion, and the role of medicine in end-of-life care. While the practice remains controversial, one thing is clear. Patients deserve a healthcare system that listens to their voices, respects their autonomy, and prioritizes their well-being above all else.
Extract 2. Questions 37 to 42. You hear a conversation with Dr. Lena Robert on cannabis. Now, read the questions. You now have 90 seconds to read questions.
Today, we're discussing a topic that has gained significant attention in recent years: medical cannabis. Dr. Lena Robert, a physician and researcher specializing in pain management, is here to shed light on its benefits and risks. Dr. Robert, why has medical cannabis become such a hot topic in healthcare, and can you share a bit about its history?
Certainly. Medical cannabis has been in use for centuries. Historically, it was used in ancient cultures for pain relief, inflammation, and even as an appetite stimulant. However, in the 20th century, cannabis became heavily regulated, and much of its medicinal use was overshadowed by legal and societal concerns. Now, research is driving a resurgence in interest. We're beginning to understand that the cannabis plant, particularly its active compounds like THC and CBD, hold significant therapeutic potential. For example, recent studies have shown that it can alleviate chronic pain, reduce nausea in cancer patients undergoing chemotherapy, and manage symptoms in conditions like epilepsy.
Those are compelling benefits. But why is there still so much controversy surrounding its use?
One of the main reasons is the lack of large-scale, long-term clinical studies. While smaller studies have shown promise, the medical community is cautious about adopting it broadly without more robust evidence. There are also concerns about its potential for abuse and dependency, as well as side effects like cognitive impairment or anxiety. Another factor is the inconsistency in how cannabis is regulated, both globally and even within countries. This creates a fragmented approach to its medical use and raises questions about quality control.
Can you explain how medical cannabis works in the body?
Absolutely. The human body has what's known as an endocannabinoid system, which helps regulate functions like mood, pain, appetite, and sleep. Cannabis contains cannabinoids such as THC and CBD that interact with this system. THC, for instance, binds to receptors in the brain and nervous system, producing pain relief but also the high associated with cannabis. CBD, on the other hand, doesn't have psychoactive effects, but can reduce inflammation and anxiety. This dual action is why medical cannabis is so versatile, but also why it must be used cautiously.
What about the risks for patients?
That's an important question. The risks vary depending on the individual and how cannabis is used. For instance, smoking cannabis can harm the lungs, similar to tobacco. High doses of THC may lead to paranoia or dependency. Then there's the issue of impaired cognitive functions, particularly in younger patients or those who need to operate machinery. That's why medical cannabis should always be prescribed and monitored by a healthcare professional who can guide its safe and effective use.
How does this translate into practice? Are there standard guidelines for prescribing medical cannabis?
That's where it gets tricky. Guidelines vary widely. In some countries, it's strictly controlled and used only for specific conditions, like severe epilepsy or chronic pain that hasn't responded to other treatments. In others, it's more accessible, which can lead to misuse or overprescription. Physicians often have to weigh the potential benefits for a patient against the risks. For example, a cancer patient experiencing debilitating nausea might benefit greatly, while someone with a history of substance abuse might face higher risks. It's not a one-size-fits-all solution.
What's your outlook for the future of medical cannabis?
I believe its use will continue to grow, as more research provides clearer guidance on how to maximize its benefits while minimizing risks. We're already seeing progress, with standardized products that ensure consistent dosages and fewer side effects. However, education is key, not just for healthcare providers, but also for patients. There's a lot of misinformation out there, and we need to ensure that medical cannabis is seen as a therapeutic option rather than a cure-all.
That is the end of Part C. You now have 2 minutes to check your answers.